Hello, and welcome to the first edition of nVoq's new podcast. I'm Morgan Schmidt, Marketing Manager here at nVoq, and for this first episode, we're going to explore how and why speech technology is becoming such a vital resource in today's post-acute care segment. To help guide us in today's discourse, we have our very own Jason Banks, Senior Director of Post-Acute Care Sales here at nVoq. Jason has been in post-acute care executive for over 17 years, having spent 14 years of his career providing technology, services, and solutions to post-acute care organizations nationwide, and 2.5 years leading a large hospice and palliative care organization in the Chicagoland area. Jason has been a speaker, podcast host, and coach for technology providers, associations, and providers with a lifelong passion for home health and hospice care. Welcome, Jason.
Thanks, Morgan. Thanks for having me, and I look forward to the conversation today. As you pointed out, I'm happy to be a part of the nVoq family, and thank you for all the work that you do with our internal teams as well as our clients out there, and really look forward to the discussion.
Well, thank you, and excellent. Let's start off by asking sort of a basic question. What is post-acute care?
Well, it is a basic question, but it's a really good question, Morgan. You know, primarily post-acute care has been a benefit historically for primarily geriatric populations focused on rehabilitative care, on ADL assistance, on end of life, on symptom management, primarily in the home. And when I say the home setting, that could be what you might think of, a house or an apartment or a condo, or it could also be a senior living community. That is a vast, many people's homes. And, you know, but it's truly grown, you know, where we've come from is, you know, having an adverse event triggering post-acute care. So I often use the analogy of Alcoholics Anonymous, which is something bad has to happen for you to show up in post-acute care. Well, that is really changing. We're starting to see home-based care for chronic disease management. We're starting to see it more and more for palliative care, for pediatric care. And so in addition to that, we're really seeing new models start to emerge. So you'll start to hear a lot about SNF at home. You'll start to hear a lot about hospital at home. You'll hear about ER diversion, chronic care management, palliative care, and the list goes on and on. So we're actually seeing, you know, specialty providers in these space and even micro specialty providers. You know, I have a friend who went to the dentist the other day and needed a root canal, and the dentist sent him to somebody who specialized in root canal. This individual did thousands of root canals per year. Now, not my cup of tea. I could never do that. But we're seeing that type of micro specialty in home-based care as well. I see, for instance, wound care providers that have traditionally treated complex wound care in a hospital or an outpatient setting start to work with managed care companies, commercial providers, to provide that complex wound care directly in the home. And so you have everything from that to organizations that are managing multiple comorbidities with social determinant of health factors within the home. And so it's really a cool sort of evolution of home-based care and really sort of diverting from just being post-acute care, which is still critically important, to being pre-acute care, to being managing of chronic care diseases. And, you know, all of this change has primarily been driven by the migration to Medicare Advantage, commercial payers, and really digital enablement, which was sped about 10 years forward by COVID. You know, so it's sort of the silver lining of COVID, if there is any, is that, you know, it's sort of fast forwarded the way that we think about taking care of individuals in a home, in their safe environment, which is where they want to be. And so that's a high level overview of post-acute care.
Wow. I didn't realize how much post-acute care had grown. So what are the main challenges and opportunities then facing post-acute broadly and perhaps hospice more specifically right now?
So I think there's, if you go to any of the conferences out there and you really listen to some of the wonderful podcasts and leaders that are speaking out there, and we'll hear more and more about this on our podcast as well. There are three main themes to challenges and opportunities that are sort of on the windshield to the landscape of these providers. And I think I'm putting them in order. One of them is the workforce shortage. And so this is top of mind for everyone. We don't have enough clinicians, and these are truly, sort of clinicians that are coming to a calling. When you're in home health and hospice, you're obviously not doing it to get rich. You're called to do this, right? And so these are really, really special men and women that are called to take care of these patients, these members in their homes, but there's not enough of them, quite frankly. And that also combined with the caregiver crisis in the country, and I'll talk more about that later on. But that is really top of mind, I think, for many of the leaders in our industry. The other one is regulatory burden. There's a lot of new regulatory requirements and a lot of new audit processes coming forward. I know that NHPCO has announced some. You've still got like your TPE, your RAC audits, your accreditation bodies that are coming out, and some of the providers have deemed status where they're, for instance, their Joint Commission surveys, their Medicare survey. And so there's a lot of regulatory burden associated with operating a provider. And it's not just their regulatory burden. They have to operate under others' regulatory burdens as well. And we'll talk more about that. And then sort of the third category, in addition to the workforce shortage and regulatory burden, is the move towards value-based care, right? The dichotomy between quality and cost. And so again, this is primarily being driven by, the move to Medicare Advantage. We're approaching, I think, over 40% of enrollees are now in a Medicare Advantage program. And, it continues to increase year over year. And so we're starting to see these Medicare Advantage plans, Medicaid Advantage plans, commercial providers start to look at how do I bend the cost curve? How do I bend the outcomes curve? And how do the payments follow that methodology? So those are really the three challenges and opportunities that I hear the most about in the industry.
So how does nVoq's speech platform help with those challenges and opportunities?
So, one of the things that, and I can start backwards to forward. So I started with workforce shortage. And, on the provider side, you'll hear a lot of the leaders talk about culture, hiring strategies, sign-on bonuses, academies or scholarship relief for workforce, referral bonuses, things like that. And all of those, I think, play a very important piece in the workforce shortage. But, one of the, sort of easier lifts, if you will, the speed to value would be employing a speech recognition platform to help alleviate some of the documentation burden on their side. One of the true hidden costs of home-based care is in that second bucket that we talked about, which is the regulatory burden associated with doing so. So, there's, and I must say, there are very well-meaning, well-intended regulatory requirements, but they haven't necessarily been thought through operationally speaking. So, and one of the things I used to call, some of these is a patient tax. A patient tax is something that is part of the care process that provides no benefit to the patient and family, and it takes away from the time that patient and family need and want, and the clinician wants to provide it. And so there are things like, double and triple documentation. When I was, had the good pleasure of serving in a hospice organization, for instance, our nurses would have to document in the EMR, but they'd also have to document almost the same exact thing in a home chart and in a facility chart to communicate that same message to the family as well as to the nursing home staff. Well, did it add value? Not necessarily, right? Because many times that clinician was having the conversation with the family, having the conversation with the senior living staff. It was really a tax that was imposed on the patient and family and on the clinician, because they both want the same thing, which is they want to spend time with one another. Another example of a patient tax that isn't regulatory driven is mileage, right? I always used to look at how long is it taking our clinicians to drive from their home to the patient site, because again, provides very little value to the care of the patient, but it's something we need to figure out how to lessen and ultimately try to eliminate. And so nVoq is one of those platforms that really enables you to minimize the patient tax, the documentation time associated with this. And so, and post-acute care providers, they don't have a lot of bandwidth, right? There's not a lot of excess people sitting around. So they really need a seamless, frictionless, speed to value proposition. And that's really what nVoq provides. I mean, I hate to oversimplify things, but the reality is you can deploy our system in 15, 20 minutes and have people trained in another 15 to 20 minutes and be up and live and operational and really enjoying the benefits of it. So I think it's really, really cool. I'm happy to be a part of this team.
Excellent. So what do you think the next evolution of technology then is going to be in the post-acute care segment?
So there's a number of them that I think are really, really interesting, and some are technology advances, some are just evolution of the marketplace. I think there's going to be a wave of AI-enabled processes, whether these be sort of in-house that are used through a business process outsourced service that are enabled through that business process outsourced service. And, I think there's a huge wave of AI that's coming into post-acute that's very interesting. While not AI, we built some interesting tools on nVoq's side to be able to, for instance, read the narrative as it's being spoken and be able to figure out whether there are pieces of that narrative that are left out of the documentation that would affect A, quality, or B, revenue. And so I think AI is a true game changer. I also believe that we're going to get to a true sort of gig economy enabled by apps and BYOD, or bring your own device. I think there's I talked a little bit about this earlier. There's a true caregiver crisis in the country, that particularly with COVID, and I think it's only being talked about to a fraction of the level that the problem exists. And I think that there's a wave coming of how do we help these individuals that may be chronic disease management or cerebral vascular disease patients in their home in a real meaningful way. I also think there's major advancement in patient engagement through things like asynchronous videos, wearables, proximity devices, and true data portability. I still can't believe the fact that a lot of the data is very much still siloed. I think we're getting better as an industry and as a country on sharing data and making data portable, but we're not there yet. I mean, I've got a son with a chronic care disease, and quite frankly, his data is siloed, and it's while frustrating, I get it because I understand both sides of it. I've been on the tech side and the provider side for a long period of time, but there's a lot of work to be done on true data portability. And then I believe analytics will continue to become more and more advanced. We'll truly get to personalized medicine methodology for providing home-based services, which is unfortunately, and I just heard a speaker recently at NVoq Financial talk about this. Unfortunately, even hospice care, end of life care, in certain ways, is still very cookie cutter from the approach. Meaning the visit strings are very similar, the order sets are very similar, and so I think one of the things that is the root cause of that is a lot of the things we've talked about today, including the worker shortage and the documentation burden. And so I think nVoq plays a true and major and substantial part of alleviating a lot of these things.
Excellent points. So how does palliative care then play into all of this?
So, palliative care is sort of the testing ground for all of this. Quite frankly, palliative care just became recognized as a specialty a little over 30 years ago and formalized less than 20 years ago in medical schools. And it's still primarily driven by physical needs of the patient, like pain, versus the holistic emotional and spiritual needs of the patient. So up until now, up until recently, providing palliative medicine under Part B in a home-based setting has provided to be difficult financially at best, and sometimes nearly impossible, depending on, the span or geography that you're serving. However, there's new payment models that are coming down the pike. And it's also something, palliative care is something that can cover both chronic care management, rehabilitation, and end-of-life care. So it covers the entire spectrum of what might be needed in a home. So I believe that palliative medicine can truly bend the cost and outcome curve, not just for the patients, but also for the payers. And again, nVoq is at the forefront of this by providing technology to allow doctors and PAs and nurse practitioners and nurses and social workers and chaplains and others to speak their dictation versus type it in. And we've seen it where they are able to do this 3 to 4 times as fast as they could from a typing mechanism. But going back to palliative care, I think it's this true testing ground for expansion of home-based services that covers everything from infants all the way through the oldest geriatric group. And so I think it's a unique sort of offering within the marketplace. I think it's being recognized as such by both the legislature and by accrediting bodies and providers and payers. And so I think I look forward to the expansion that palliative care has to play in the marketplace.
Excellent. Well, this has been incredibly insightful. Thank you so much for your time and expertise with this.
Thank you, Morgan. It's a pleasure, and I look forward to continued discussions.